After a vaginal or caesarean birth, it takes 6 to 12 weeks to fully recover. During the period of recovery, there are many physical and emotional demands on a new mum. Each person's experience is unique. Many new mothers feel immense pressure to get back into shape and fit into pre-pregnancy clothes, and there is an added pressure to be breastfeeding and housekeeping like a champion. Changing hormones cause extra sensitivities and challenges. In reality, the first 6 weeks is a time of recovery that needs special care. Women can be active participants in their recovery process. Healing comes with rest, nutrition, hydration, and reducing demands as much as possible. Some days feel better than others, and discomfort or pain is common in the first few weeks as the body recovers. Some women can feel pain where wounds are healing, in the vagina, the tummy, perineum, back and neck. Mothers who are breastfeeding may have tender nipples and uncomfortable blocked milk ducts. It's important to listen to the body and make healthy choices. Be consistent with fluid intake and aim to drink a couple of litres of water a day. Sometimes the bladder can feel different after birth, so use the toilet every 2 to 3 hours, whether the bladder feels full or not, to ensure that you're regularly emptying. Create nourishing meals that promote health. Eat foods like prunes, pears, apples to keep your stools soft and avoid constipation. Stools should be easy to pass with no straining. Sitting on the toilet using a footstool is a good position to empty the bowel. Place flat feet on the stool with your legs apart and lean forward. Use relaxed breathing without straining, and support the perineum with your hand if you need. Walking is the best exercise that you can do after having your baby. Wear comfortable walking shoes, lengthen the spine and stand tall. Avoid strenuous exercise. Rather, try and get outdoors every day for a gentle walk on flat ground. Each day, increase the distance that you walk. Swimming is safe once vaginal bleeding has ceased and wounds have healed. Exercise improves your mood, relieves stress and prevents postnatal depression and constipation. Avoid exercises that cause bladder or bowel leakage, any vaginal heaviness or pain. These symptoms can take up to 6 months to settle. After caesarean birth, avoid vacuuming or lifting anything heavier than your baby for the next 6 to 12 weeks. Avoid bending. Driving can be uncomfortable after birth. Ensure that the driver is able to brake, move feet between pedals and look over the shoulder without discomfort before driving. It's important to give the body time to recover and avoid injury. Low estrogen levels after birth can cause bladder sensitivity and poor vaginal sensation. In the first 6 weeks, it's common to have minor bladder leakage with coughing, bending, lifting, or loading. Low levels of estrogen can cause dryness of the vagina. These hormonal changes can also affect sexuality. Resuming sexual activity depends on the woman's physical and emotional comfort. Avoid any sexual activity that is painful. During sexual activity, use lubricant and position yourself for comfort. Open communication and sharing feelings are really essential for intimate relationships to remain healthy. Maternity bras without underwire are a good choice. They should be comfortable and supportive. Firm, comfortable, high-waisted underpants promote healing. Avoid lacy, cheeky or sexy undies because these styles can cause pain and delay healing. When there are stitches to care for, good hygiene is also important. Keep the area clean, wash only with water, avoid soaps and sprays, and pat dry. Remember to change pads regularly. Aim to lie down for 30 minutes to an hour once or twice a day when your baby is sleeping. Practice relaxation and release stress and tension from the muscles while you're resting. This will optimise healing. While resting, squeeze and lift the muscles in the vagina, pretending that you're holding in a wee. These are your pelvic floor muscles. Breathe. This gentle muscle pump action provides circulation and reduces swelling and assists further in healing. Pelvic floor muscle exercises help with bladder and bowel control, support your pelvic organs and improve sexual function. Activating the pelvic floor muscles enhance healing by increasing blood flow to the area. In the first few days, repeat the gentle contractions throughout the day and then progress it to a higher commitment. Start by squeezing gently and lift 10 times with a short rest in between. Place reminders in areas of the house for promoting pelvic floor exercises. Gradually increase the hold each day and continue to do 10 squeezes in a set. A chart is a useful guide to assess your progress. Aim for about 3 sets of exercises a day. When brushing your teeth, when boiling the kettle, after going to the toilet. Ensure good posture during baby cares. Get help to carry heavy loads. Use good technique when you're putting the baby into the car. Avoid straining the back by bending over and keep work surfaces at a waist height. When picking up the baby, pull up the pelvic floor muscles and gently brace with the lower tummy muscles. Engage these core muscles and breathe. Especially do this while you are bending and lifting, and it will become more automatic. The postnatal period is a challenging recovery time coupled with the demands of mothering. It's important to ask for help when needed and to prioritise self-care. A gradual return to pre-pregnancy exercise is recommended, but after 12 weeks. If pain or concerns persist, contact your midwife, nurse, physiotherapist, or doctor for advice.